Assalamualaikum and hi. Today our group will present about shingles. So, what is shingles? Shingles, also known as herpes zoster or zona, is a virus syndrome caused by reactivation of the varicella zoster virus. After an episode of varicella, which is also known as chickenpox, the varicella zoster virus remains dormant in the nervous system. Anyone who has recurrent chickenpox can cause shingles to happen. Varicella and herpes zoster are different manifestations of the same virus infection.
Anyone who has been infected with white-type varicella zoster virus (VZV) or who has had varicella vaccine can develop herpes zoster. Children who get the varicella vaccination have a decreased chance of developing herpes zoster than children who are infected with white-type VZV. Many people have no memory of having chickenpox. Nonetheless, about 99.5% of persons born in the United States before 1980 had been infected with white-type VZV. As a result, nearly all elderly people in the United States are at risk of herpes zoster. So, in terms of shingles epidemiology or herpes zoster, the yearly rate is estimated to be around 4 cases per 1,000 US population per year. It affects around 1 million people in the United States each year, and the incidence rises with age. So, for youngsters, they may have had fewer than 1 case per 1,000 children, but for those over the age of 80, they had more than 15 cases per 1,000 people. The lifetime risk of acquiring herpes zoster in shingles patients is around 30%, and the constant incidence of herpes zoster of post-herpetic neuralgia (PHN) also rises with age.
Varicella zoster virus infect the nasopharyngeal lymphoid tissue of a susceptible host through airborne droplets during the initial phase of the disease. This causes viremia, which is made up of VCV-infected T cells that go through this tissue and throughout the body. As a result of viremia, VCV may also infect neurons. To stop infection, VCV-specific cell-immediate immune response that arise during varicella are essential. These reactions are also important in maintaining VCV latency and reducing the virus' ability to reactivate and produce herpes zoster, which is as known as shingles.
Early symptoms of shingles may include fever, chills, headache, fatigue, sensitivity to light, and stomach upset. Other signs and symptoms appearing a few days after the early symptoms include an itching, tingling, or burning feeling in an area of skin, redness in the skin in the affected area, raised rash in a small area of skin, fluid-filled blister that break open then scab over, and mild to severe pain in the area of skin affected. Treatments for shingle disease. To reduce pain and speed recovery, you need to take oral medication such as antiviral medication, including acyclovir, valciclovir, and famciclovir. To ease pain and swelling, you need to take oral medication such as anti-inflammation drugs, including ibuprofen. To treat itching, you need to take oral medication such as antihistamines such as diphenhydramine. To reduce pain, you need to take topical medication such as numbing creams, gels, or patches such as lidocaine. The signs and symptoms of herpes zoster are usually distinctive enough to make an accurate clinical diagnosis once the rash has appeared. However, the diagnosis might not be possible in the absence of a rash. Herpes zoster is sometimes confused with herpes simplex and occasionally with impetigo, contact dermatitis, etc. It can be more difficult to diagnose in children, younger adults, and people with compromised immune systems who are more likely to have atypical presentations. So, it can be tested with laboratory diagnosis where polymerase chain reaction (PCR) is the most useful test in cases with less typical clinical presentations, such as in people with suppressed immune systems who may disseminate herpes zoster. PCR is the most useful test for confirming cases of suspected zoster sign herpes, ZSH, or also known as internal shingles, or shingles without a rash.